We hear about new viruses emerging all the time. From the latest headlines to the constant updates on our phones, it seems like there's always a new health threat on the horizon. Some of these viruses are more concerning than others. While many may cause mild illnesses, there are those that pose significant risks to public health. Among these, superviruses are a growing threat that we need to understand. These are not just any viruses. They have unique characteristics that make them particularly dangerous. These superviruses are not new, but they are becoming more difficult to treat. Over time, they have evolved and adapted, making them resistant to many of the treatments that were once effective. This is important for everyone, especially for older adults who can be more vulnerable to infections. As we age, our immune systems weaken, making it harder to fight off these powerful viruses. This essay will explain what superviruses are and why they are a concern. We'll delve into their origins, how they spread, and the challenges they present to modern medicine. We'll discuss how they become resistant to treatments and how changes in their genetic makeup can make them more dangerous. Understanding the science behind these viruses is crucial in developing effective countermeasures. We'll also cover practical steps you can take to protect yourself, including the importance of vaccination and a healthy lifestyle. Vaccinations are one of the most effective ways to prevent infections, and maintaining a healthy lifestyle can boost your immune system. Knowledge is power when it comes to safeguarding our health. By staying informed and taking proactive measures, we can better protect ourselves and our loved ones from these growing threats. So let's dive in and learn more about these superviruses and what we can do to stay safe. Superviruses are not a different species of virus. They are essentially the same viruses we have always known, but with a twist. They are viruses that have become stronger and more difficult to fight. This increased strength comes from their ability to adapt and evolve in response to the medications we use against them. Think of them as viruses that have learned to outsmart our medications. Just like how some bacteria become resistant to antibiotics, these viruses develop resistance to antiviral drugs. This happens when viruses change over time, making our usual treatments less effective. These changes, or mutations, can occur naturally as the virus replicates, or they can be driven by the selective pressure of antiviral drugs. One of the main reasons superviruses are a concern is their resistance to antiviral drugs. This resistance means that the medications we rely on to treat viral infections may no longer work as intended. Antiviral drugs are medications specifically designed to target and kill viruses. They work by interfering with the virus's ability to replicate and spread within the body. However, when viruses mutate, they can change the way these drugs interact with them, rendering the treatments less effective or even ineffective. This can lead to prolonged illness and increased transmission of the virus. This makes it harder to treat infections and control the spread of these viruses. The medical community must constantly adapt and develop new strategies to combat these evolving threats. This includes researching new antiviral drugs, improving existing treatments, and implementing better infection control measures. Understanding the mechanisms behind viral resistance is crucial. Scientists are working tirelessly to uncover how these superviruses develop and spread, which can help in creating more effective treatments. Collaboration among healthcare professionals, researchers, and policymakers is essential in the fight against superviruses. By sharing knowledge and resources, we can stay one step ahead of these formidable foes. Public health initiatives such as vaccination programs and education campaigns also play a vital role in preventing the spread of superviruses. By taking proactive measures, we can protect ourselves and our communities from these evolving threats. While the challenge of superviruses is significant, it is not insurmountable. With continued research, innovation, and cooperation, we can develop the tools and strategies needed to overcome these powerful adversaries. Imagine a lock and key. Antiviral drugs are like keys designed to fit specific locks on the surface of a virus. These keys work by blocking the virus from entering our cells and multiplying. However, when a virus mutates, it's like changing the lock on the door. The old key, the antiviral drug, no longer fits, and the virus can continue to spread. This resistance to treatment is a major challenge in managing superviruses. It's like a constantly moving target. As viruses evolve, we need to develop new strategies and treatments to stay one step ahead. Viruses are constantly changing. Most of the time, these changes are minor and don't make the virus more dangerous. However, sometimes mutations can make a virus more transmissible, meaning it spreads more easily from person to person. Mutations can also make a virus more likely to cause severe illness, or even death. One well-known example is the influenza virus, which undergoes frequent mutations, leading to new strains emerging each year. This is why it's important to get a flu shot annually, as the vaccine is updated to target the most prevalent strains circulating. Vaccines are best defense against superviruses. Vaccines are one of the most effective ways to protect ourselves and our communities from superviruses. They have been a cornerstone of public health for decades, helping to control and even eradicate deadly diseases. Vaccines work by introducing a weakened or inactive form of the virus into the body. This process is designed to stimulate the immune system without causing the disease itself. The immune system then learns to recognize the virus and mounts a defense against it. This teaches our immune system to recognize and fight the virus if we encounter it in the future. Essentially, it's like training our body's defense system to be ready for a potential attack. This preparation is crucial in preventing outbreaks and protecting public health. When enough people are vaccinated, it creates something called herd immunity. Herd immunity occurs when a large portion of the community becomes immune to a disease, making the spread of the disease from person to person unlikely. Herd immunity means that even if a few people get sick, the virus is less likely to spread widely because most people are protected. This collective immunity is vital in protecting those who cannot be vaccinated, such as newborns or individuals with certain medical conditions. This is especially important for those who are more vulnerable to serious illness, like older adults or people with weakened immune systems. By getting vaccinated, we not only protect ourselves, but also contribute to the safety and well-being of our entire community. Vaccination is a shared responsibility and a powerful tool in our fight against superviruses. The development of vaccines involves rigorous research and testing to ensure their safety and effectiveness. Scientists and healthcare professionals around the world work tirelessly to develop vaccines that can protect us from emerging superviruses. These efforts are crucial in staying ahead of potential outbreaks and ensuring global health security. Public awareness and education about the importance of vaccines are also key components in our defense against superviruses. Community health workers and organizations play a vital role in spreading accurate information and dispelling myths about vaccines. By staying informed and encouraging others to get vaccinated, we can build a healthier and more resilient society. In conclusion, vaccines are our best defense against superviruses. They protect individuals, create herd immunity, and safeguard vulnerable populations. Through continued research, public education, and community efforts, we can ensure that vaccines remain a powerful tool in our fight against infectious diseases. Let's all do our part to protect ourselves and our communities by getting vaccinated. Boosting your defenses, healthy habits for a strong immune system. While vaccines are crucial, there are other things we can do to support our immune systems and stay healthy. Our immune system is like our body's internal defense force, fighting off infections and keeping us well. Just like a strong army needs proper nourishment and training, our immune system thrives on a healthy lifestyle. This includes eating a balanced diet rich in fruits, vegetables, and whole grains, getting enough sleep, managing stress, and engaging in regular physical activity. These habits can strengthen our defenses and make us less susceptible to infections. Staying informed. Your health is in your hands. In today's digital age, information is readily available at our fingertips. Staying informed about potential health threats, including superviruses, is crucial. Reputable sources like the Centers for Disease Control and Prevention and the World Health Organization provide up-to-date information on outbreaks, prevention tips, and travel advisories. By staying informed, we can make informed decisions to protect ourselves and our loved ones. Remember, knowledge is power when it comes to health. Seeking expert advice. Your doctor is your partner in health. Your doctor is your trusted ally in navigating health concerns. If you have any questions or concerns about superviruses or any other health issues, don't hesitate to reach out to your healthcare provider. They can provide personalized advice based on your individual health status and risk factors. Regular checkups and open communication with your doctor are essential for maintaining good health, especially as we age. Remember, prevention is always better than cure. Protecting our future superviruses and a proactive approach to health. Superviruses are a reminder that the world of infectious diseases is constantly evolving. We need to remain vigilant and proactive in safeguarding our health. By understanding the challenges posed by superviruses, embracing vaccination, adopting a healthy lifestyle, staying informed, and seeking expert medical advice, we can navigate these challenges effectively. Let's prioritize our health and well-being, not just for ourselves but for generations to come. Together, we can create a healthier and more resilient future.